Meanwhile, in Lagos State, the government is still keeping up with the drive to provide good and accessible healthcare to residents in the state through its insurance health scheme coined Ilera Eco. In this report, senior correspondent Jacqueline Ogo takes a look at a collaborative effort by another government agencies to promote more access to the health insurance scheme.
Lagos State government has begun its plan to make compulsory registration for residents in its health insurance scheme. This is to ensure no one is left out of the government's agenda to have a healthy population. To this effect, the Lagos State Lottery and Gaming Authority is lending a supportive hand to the Lagos State Health Management Agency, LASHMA, through the payment of insurance policy premiums for residents across senatorial districts of the state.
We're giving out 70 individual policies and we're giving 30 families for family policy, which allows them to access health care for 4 people within the family, which is equivalent to 120 people within the family, and then plus an extra 70. So this is reaching 190 beneficiaries. And they have access to going to any primary health care, general hospitals and private hospitals to access health care depending on their respective needs for a period of 1 year.
There is a procedure being followed by the agency in picking the beneficiaries.
We have people within respective communities who choose within the community, people who are from low-income backgrounds, who typically might not have had access to good health care, to let them know that since you're unable to afford it, the state is supporting you to be able to afford it for a period of 1 year, and then also to expose other people to knowing that for a token, which is not so much, they can have access to this same health care, eyes, ears, dental, surgeries.
As the beneficiaries count their gains, they are also calling out for more interest and participation in the health insurance scheme.
I think this is one of the best programs that has come to stay in Lagos. And I think I want to give applause to the people that brought this program down.
This is a program that is meant to go the whole country round, if you ask me. So for me, I'm in, and I'm also going to be like an unsolicited ambassador. It's way cheaper than the regular.
The health insurance scheme is a good way for us to take good care of ourselves and always check our health, because health is wealth. A healthy man is one that creates wealth.
The executive director of the Lagos State Health Management Agency, LASHMA, says the scheme is approachable.
We have alternatives for you. If you cannot pay the premium, which is just 15,000 per year per person, or 55,000 for a family of 4 and 80,000 for a family of 6 per year, we have alternatives for you to be able to pay small, or as we say in Yoruba, so dear. They will give you the options as to how you can do that, so that you and your family will begin to enjoy qualitative care.
The overall target of the Lagos Health Insurance Scheme is to achieve total health coverage for all residents through the elimination of out-of-pocket payment for medical services, thereby shielding vulnerable residents from poverty. This is in line with the United Nations Health for All by 2030, in alignment with the UN Sustainable Development Goal 3. Jacqueline Ogo, TVC News, Lagos.